And well, this week is National MS Awareness Week, so we wanted to take some time to talk about the disease. Plus, there are some upcoming events that you can take part in to help continue to raise funding for research. Dr. Anna Veit is a neurologist at Mercy Health. She joins us now to talk a little bit about multiple sclerosis. This is a disease that actually is fairly common. It impacts a lot of people.
That's right. It affects about 1 in 350 people, and it's most commonly diagnosed between the ages of 20 and 40, which is pretty young.
Yeah, it is. So what exactly is MS? We hear it a lot.
Sure. So multiple sclerosis is an autoimmune disease where your own immune system goes rogue and attacks healthy tissue in your brain, spinal cord, and sometimes optic nerves, or the nerves that control vision.
Yeah, so how would this present itself?
Right, so MS attacks present differently for everybody. Sometimes people will lose vision in one of their eyes or have double vision and slurred speech or numbness and tingling in their arms and legs.
And most people might just go, oh, well, my vision's a little off, or, oh yeah, that's a little tingling. They may not connect all those dots. So when a patient comes in to you, how do you go about making that diagnosis?
Right, so we use a lot of different tools to make the diagnosis. One is getting a good history and doing a good exam on the patient, and then we also use MRIs and sometimes lumbar punctures or spinal taps to help make a diagnosis.
Ooh, okay. So, and this can really, make an impact on someone's quality of life. I think we hear about some celebrities that are out there who have come out to talk about it and what it's done to them in their lives. But what kind of treatments are available? Is there kind of any hope there if you get that diagnosis?
Yeah, so absolutely. So MS is a treatable disease. We don't have a cure, but we have lots of medications out there to calm the immune system and to prevent new attacks from happening. I would say most people who are getting diagnosed now tend to do pretty well, and a lot of my patients, you would never know they had MS unless they told you.
Okay, is it degenerative? Does it get worse, or?
So some people just have attacks, and in between attacks they do great. Other people get gradually worse over time, even without having attacks.
So different for every patient.
That's right.
Isn't that the case? And we have a couple of events that are coming up. We've got Bike to the Bay, which is a big one, and also there's a walk, the Walk MS, that's coming up on May 18th. We were just talking about Glass City Metro Park. Great place to go for a walk. This is to raise money for research. And what kind of research are we looking at here when it comes to MS?
Absolutely. So we're always looking for new medications to calm the immune system. What we really need now is a medication or a treatment out there to repair damage that's already been done, because that we don't have. So it's really important to raise money for MS research.
And I imagine that people to come out and support means a whole lot for patients who are dealing with this every single day.
Absolutely, it means a lot. And if I can just give a little bit more information about some stuff we have available through Mercy Health. You don't have to be a Mercy patient to come to these. Anyone's invited. We have our MS support group that meets the first Tuesday of every month at the Way Public Library in Perrysburg. And our wonderful physical therapy team is starting an MS wellness and exercise class. That is going to be the second Monday of every month. It starts on April 14th. It's going to be at 6 p.m. at St. Anne's Hospital.
Oh, wonderful. So this is something, maybe if you are going through your symptoms or you're in a flare, if you will, this is something that you might be able to do that is easier on the body.
Absolutely, yeah. It's for people of all ability levels. They're going to have chair yoga available for people who aren't able to get down on the ground.
Yeah, I see you're wearing your orange today.
That's right. Happy MS Awareness Week.
Yeah, so as a neurologist, what does that mean to you to take a week aside every year to talk about this?
Well, I think it's a great opportunity to raise awareness. And I'm actually an MS specialist, so that's where my specialty training is. So I'm always excited to talk about MS.
Yeah, when you first got into it, what made you say, I want to be able to focus specifically on that?
Right, I really like developing long-term relationships with my patients, and I liked working on a disease that has like good treatments out there and that people tend to do well.
And for people out there who are saying, I've been feeling this or I've been feeling that, not really sure what exactly is going on, what's a good first step for them?
Just talking to their doctor, and if they think it's warranted, getting a referral to a neurologist for further evaluation.
Yeah, and so it would start with the GP and kind of go from there.
Absolutely, yeah.
So if you want to help, though, this is the week we're talking about it. We're raising awareness. You want to help do something to raise that money for this research, again, we have the walk that's coming up
Right.
in May, and then also a Bike to the Bay, which is a big one that happens every single year. You get on a bike and you go all the way to Port Clinton and then Put in Bay and have a good time. That's coming up in June. So there's the information on your screen there about how to register and what to search for. And just go ahead and do it now while we're talking about it. Yeah,
Absolutely. Yeah, that's great.
Thank you so much for coming today and for your time. We appreciate it.
Oh, thank you so much for having me.
Absolutely.